welcome to Senior Happenings. My name is Tricia Ayers and I'll be your host today. In the show, we are talking about memory care, activities, and also veins. It'll all make sense when you listen to the whole show. So my first guest is Debbie Cousino, and she is from Magnolia Place. Debbie, welcome.
Well, thank you. It's nice to be here.
See, and I got through the last name.
Yes,
We've
you
known
did.
each other
You did
forever.
great.
Thank you, thank you. Debbie, we're going to be doing the Senior Expo coming up.
Yes, and I'm excited.
That's very exciting.
I'm
You're
excited.
always such a good supporter, Magnolia Place is. First of all, tell us a little bit about Magnolia Place and what it is.
Okay. Magnolia Place is an assisted living for memory care. Basically, we take care of anybody that has Alzheimer's, any sort of dementia. We keep them very busy, very active. That's our goal. We like to look at the social model versus the medical model. Yes, we take care of their medical needs, but up front and foremost, we're going to take care of their social needs because they need to be kept busy all day and keep that brain active.
And I know that it's very important when we say Magnolia Place, we say assisted.
Yes, it's assisted living. It's not a skilled nursing. Sometimes people want to come to us. They don't want to go to the skilled nursing. They want the assisted living. But then they want the part of the skilled nursing where you're taking care of most of their needs. We do more than assisted living normally would because they do need more cueing. They do need more help getting through the steps of their daily life activities, and but we're not quite at the skilled nursing.
Right, very important.
Very important
Very
to know
important that we find the right resources at the right time.
Absolutely.
One thing I know about Magnolia Place and you yourself, you are always doing activities.
Always.
With your residents, your family there. Always. Your social media is always buzzing with things that you do for your folks. And so today I wanted to talk a little bit about people who are at home maybe, who have a loved one that is still at home and has Alzheimer's dementia and is not yet ready to go to Magnolia or go to skilled nursing.
There you go.
What are some of the activities that probably you guys do that they could be doing at home?
Oh, everything we do there, they can be doing at home.
Okay.
They can, it's got to be modified. Most of the time when you got your loved one at home and you're wanting them to be busy, we're looking for perfection. It's not going to happen. We need the connection. We need emotional support. They need to be busy. And the frustration on the family will go into the feelings of the family member. So you're going to look for things that make them feel important and still have a purpose. So you're going to find things like maybe during the day, early in the morning, you might want them helping you fold the laundry. That's very important. We have residents that will fold laundry all day long. We just take it around the corner, unfold it, and give it back to them, and they can fold it again. Or maybe they're doing flower arrangements, something that gives them a purpose. And then you're going to have the wanderers. If you have somebody wandering around the house, be very careful. They're not getting out of the house and going down the sidewalks and getting lost. But walk with them, talk to them, play music, put music headphones on them, something soothing to calm them down so it's not a bebopping. We get to the point, sometimes in the morning we get pretty beboppy in our special events, we're dancing around. But when you need them to slow down and relax and get some downtime, you need to put that soft music on. They're going to walk slower, they're going to walk softer, they're going to start resting a little more.
Right. And that key, we're not striving for perfection.
That's right. That's right. If they're coloring a picture, you know, oh, my mom's not coloring, she's too old. Wrong. Some of my favorite memories right now is coloring with my grandkids. So that always comes back. You're going to have kids in the building or at home, you're going to have grandkids. Let grandma come out or great grandma come out and color with them. And if you don't like the idea of color crayons, there's always called adult coloring, and nowadays it's pretty nice because you have the books out.
Yes.
But you still need them to be simple, not too intense, because then they get frustrated because they can't do it. Frustration is a bad thing.
Right.
You need it to be, even if you don't think it's perfection, you tell them it is.
Right.
You did a great job. And just like we do with our teenagers and stuff, you know, you get them to learn things, you get them interested. And if it's something they used to do in their life, in their jobs, find a way to modify it so they can accomplish it. Example would be, I had a pharmacist one time. He was pretty late stages, but what we found for him is he had his pharmacy books. The nurses got him the pill bottles. We bought the M&Ms, and he would sit and sort them all day long.
Yes.
And he felt accomplished getting those bottles filled.
Because we talked about earlier, sometimes when somebody gets a diagnosis and they start to slow down or things become a little blurry for them, we tend to just sit them off to the side.
Yes.
And maybe put the TV on, and that's okay. Everything's good, and everything is not good at that point. Because I know when they come to Magnolia, they're not sitting there watching TV all day.
No, not at our place. No, they're busy all day long.
Right.
They're busy all day long. You know, if you're cooking dinner, let them sit at the table and snap those beans, snap those peas, peel those peas out of the hulls, whatever you call them.
Yes.
Let them help you with the dishes. Put the dishes in the dishwasher. Polish silverware. If they're to the point where you're afraid they're going to put it in their mouth, use mayonnaise. Polish that silverware with mayonnaise, and if they put it in their mouth, they're not going to be hurt, and they think they're really polishing.
Right.
Anything like that will help. Fold those towels.
So we're just doing modification.
Modification, whatever works. And if they want to walk, like I said, walk with them. Take them for short strolls. Make sure it's safe. Watching the dog, babysitting the dog. Dogs, cats, and children are the best thing those people can have to work with. And if they're babysitting, you're babysitting your grandkids, let Mom come out and help you.
Right. And I know something that you do at Magnolia when somebody becomes a resident, when they first become a resident, you take a lot of information about history.
Yes.
And that's maybe something people could stop and do at home.
Oh, yes, yes. You got photo albums from years ago. Sit down there with those photo albums. Talk about what those photos meant. What were you doing at that time in those photos? Were you on vacation? Were you working? Start your bio, and boy, when they have to go to someplace, it really helps because then those activity staff, the social staff, the nursing does a lot of activities they don't realize they do, but they do. As long as they know the background, we can talk to those residents and about what was important to them. Ask them simple questions that you know they can answer. Don't get them frustrated. Same thing happens at home.
Yes. I know another thing that you do so superbly at Magnolia Place is you feed people. I mean, I know that we get to participate when you come out to events and you bring the chef and you bring pies and everything, but we are not doing bland food at Magnolia Place.
No.
So it would be nice if we're not doing bland food at home too.
That's right. That's right.
Those senses don't switch off. And tell me about some of the delicious food that you, or maybe not, you know.
Maybe not. Well, something cool too, our chef will come out once a month and do a demo and let the residents help. And the activity staff will do a small cooking or baking group.
Nice.
And for those homemakers or the grandmas who love to make cookies for their grandkids, what a perfect time. The events, whatever's going on, like our Bring on the Green that we had in March, everything was green, from grapes to celery to bell peppers to cupcakes with green frosting, green coated pretzels. Oh, we found all kinds of green. And then the residents really enjoyed the different tastes, and they will do that as a sensory thing as well, an activity. They had a pepper tasting day one day, and those, I'm thinking, what are you guys doing? But they started with the mild one, and it got to be a competition with some of our earlier stages, and they were having a blast tasting those hot peppers. I didn't involve myself.
No, I wouldn't have done either. I wouldn't have done either.
Not me. But being involved in the process is a big thing, and our chef is really great about that.
Yes.
Chopping, don't give Mom a knife, she's going to cut herself. I might cut myself.
Right.
It's part of life, it's part of what they did.
Right.
And giving them a butter knife to cut something like an apple doesn't work. It doesn't have to be super sharp, or you can kind of gauge where they're at as far as not so they don't get hurt.
Right.
So chopping and peeling and pulling lettuce apart, things like that and it makes them feel accomplished.
Absolutely.
Yes.
Absolutely.
Yes.
So yes, so we need folks at home, if you have a loved one, get them involved, really get them involved. Don't sit them off to the side,
No.
get them involved. And another thing that I love about Magno, I mentioned the social media, but guys, dance. You
Play
have
ball.
Play ball. There are characters that come in. You have special events that you invite people to come. It's a very open environment
Sure.
where you are.
You need to keep them little active,
Yes.
throwing the ball back and forth. We now put in a little putting green, well, 2 of them,
Oh.
in our middle courtyard. We have a basketball hoop that some of the guys will go out, even if they're in a wheelchair or sitting in a chair, they can exercise in the chair.
Right. Right.
Simple. They do exercises every day. You got to keep them active, got to keep them moving, and not just sitting in the chair doing nothing.
Absolutely. Absolutely.
Very important.
100%.
That's good for the mind as well.
Yes, and you guys do that so splendidly.
Thank you.
So splendidly.
Thank you. We do. We do.
You
I'm
do.
proud of them. Yes.
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 Tell us about, I think you have an upcoming event other than we're going to be at the Senior Expo.
Yes, we're going to be at the Senior Expo. That's great.
Yes, April 30th at St. Bernard's Church, 9 to noon. But you have a Mother's Day tea coming up?
We do
Okay.
on May 8th, and the public is welcome to come. And if you have a loved one at home with dementia, you just want to bring them in and sit with them and have time with us, that's perfectly fine. It is, like we said, a Mother's Day tea. We'll have all kinds of flavors of tea and honey and sugars and all kinds of little petite sandwiches and cookies and bonbons and all that fun stuff. And we even have a maitre d' that will be coming in and seating them at the tables. All the ladies will be dressed up fancy with their little hats and gloves and maybe a couple boas, you know.
I love
just
that.
Fun.
But how
Fun.
special, and that is a great opportunity for somebody who is at home with a loved one. Bring them, bring mom,
Absolutely.
bring mom to the tea.
Yep. We always encourage people to come in. And if you're thinking about going to a community, and it might not be Magnolia Place, it might be another place, ask. And most places will be more than willing, and start bringing every once in a while to an activity. You can always get somebody's calendar. We put out a great calendar. Ask, can I bring mom to your activity? Pretty soon mom will be used to, or dad will be used to coming in and doing that. And when it comes time where they really need to go, they'll be used to the area.
Do you do respite care?
We do.
Okay.
It's a minimum of 2 weeks that we require.
Okay.
And they get all the same treatment anybody else that lives there would get.
So if somebody is
Wanna go on vacation?
yes, because that's the problem sometimes.
Sure.
Caregivers never take a break.
Yes. And even if you have people come in, can you trust that they're going to be there?
Yeah.
People go on vacation. They go on business trips. I've had people come in 3-4 times on respite before they've had to move in.
Nice. Nice.
Yes, it works well.
Debbie, thank you as
You're so
ever. Always
welcome.
love talking to you.
You too.
Always love talking to you, and I will see you at the Senior Expo.
You betcha.
Yes. Are you bringing
I
cake?
think I heard it was strawberry cheesecake.
Okay. Yes. Save room.
Pie, yes.
Save room for strawberry cheesecake.
Great chef we have.
We're going to take a very short pause, and we'll be back, and we'll be talking about veins and arteries and all that good health stuff. We'll see you in just a few moments. Welcome back to Senior Happenings. We have our guest now is Jonna Goins, and she is with Ozark Regional Artery and Vein Center. I think I got that correct.
Vein and artery, but you know, it's all vascular. It goes hand in hand.
Maybe we need to just cut and go back, and I do that again. Anyway, Jonna, welcome to the show. Thank you so much for being here.
Thank you.
I think vein and artery health is very important.
So important.
Didn't really realize how important it was, but the more I hear, the more we need to take care of that.
Agreed.
Can we talk when you are maybe, let's deal a little bit older than myself, 60, what are the important things that we need to know about vein
Yes.
health?
Of course, veins affect a variety of patients, all different ages, and some can be very, very serious. But when we're talking about 60 plus, we're more talking about arterial issues.
Okay.
So specifically, peripheral artery disease, that's PAD for short.
Okay.
That is what deals with the narrowing of your arteries in your legs. And so that's when we see a variety of problems. And a lot of people don't know how serious it is, but it is very serious.
What are some of the signs that people would feel
Oh, sure.
for that?
Yeah, so a lot of times it starts out with pain, and we're talking about pain that goes away when resting. Now, if it doesn't go away when resting, that's a more serious, still vascular issue, but it's progressed a little more. Something you might also deal with is numbness, discoloration in your legs, your toes. Sometimes your hair will stop growing on your legs. All those are signs that you need to seek vascular help and that there is something wrong with your circulation.
So hair may stop growing on people.
Yes. Yeah,
Most of us would see that as a good sign, and it's not.
Yeah,
No.
you would, and you will notice a lot of times it'll be really shiny
Okay.
on their calves and lower. It's a very distinct look. Also, something I will bring up is risk factors.
Okay.
Because a lot of times people have PAD and they don't even know it because there aren't any symptoms. But if you have diabetes, if you're a smoker or did smoke in the past for a very long time, those are two, and you're over 50 or 60, those two things coupling, you need to come see us. The other factors are cholesterol and high blood pressure. So a lot to keep in mind.
That is a lot. So generally do you see people coming through their PCP and then they're referred to you, or can they go straight to you if they feel like they have an
They
issue?
can go straight to us, but we see tons of referrals in the area.
Okay.
So either way, but they can call us today.
Today, right now, at the number. So you were saying that vein health for all ages. I'm going to go off script here. What
Love
do
it.
you see in our younger folks?
Oh, sure. Like a lot of it's more cosmetic. So it's
Okay.
varicose veins, spider veins, those types of things. We have a very skilled team. We don't just treat the symptom. We try to treat the cause of the symptom.
Okay.
So a lot of times we'll see a repeat patient that went to a different clinic to get rid of those spider veins, and because the underlying issue was never taken care of,
Yes.
those things tend to come back.
Right. How do you address it? Because I know 50s, going towards 60, a lot of things are just, well, you're just getting older. It's just part of aging.
We see that a lot. So what we like to tell patients is pain is your body's response. Say, hey, I need help. Can you do something? And so I say, do not ignore pain wherever it is in your body, but definitely like pain is very serious. Don't ignore it.
Okay. But we do.
We do.
That's
Yes.
the problem sometimes.
It is.
That is the huge problem that we do ignore it.
Everyone is like, oh, I'm getting older, my
Yes.
joints are hurting. Everything,
Yes.
increases with age, but vascular care is very serious.
And I think sometimes when kids are taking care of aged parents, 80s, 90s, whatever, they're not always seeing the symptoms, and the parent is not always speaking up.
Correct.
That's the problem.
Correct.
So
You're right.
that's a hard one to navigate.
Absolutely.
And our PCPs don't have a lot of time with us when we do go for those regular checkups. So kids have to pay attention.
Yes.
Loved ones
Yes,
have to pay attention.
for sure.
So, okay. How did you get into this line of work?
Well, actually, that's a funny question. I had no clue about veins or arteries or anything, and I was a mountain bike coach for high school kids. And so the surgeon I work for now, Dr. Stout, who does all of the arterial work for us, he
Yes.
was also a mountain bike coach, and his son was on our team. That's how we got connected. And yeah, he was like, I would really like for you to come work for me. And then here we are.
Wow,
three
that
and
is
a half years
fun
later.
story.
Yeah.
And what were you doing before that? If I can ask?
Real estate,
Okay.
mostly all real estate for like the last 6 years. Yep.
Okay, so coming from a real estate background into vein and
Yes.
what have been some of the most shocking things that you didn't know about veins and arteries?
Veins to me, because they tend to be a little bit more superficial. I say that, but some vein issues can be very serious. The arterial part was very shocking. Watching doctor help patients who had non-healing wounds, or one guy came in, this is going to get very gross very
That's okay.
quickly.
We can take it.
Okay. Black toes and
Yes.
that sort of thing, and then talking about amputation. All these things could have been prevented had they came and seen doctor
Right.
way sooner.
Right.
So
Ah,
I know. But it was so shocking because I've been sales my whole life.
yes.
So
Yes. 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 Yes.
very shocking.
So what's one thing you want our 60 and I'm not going to say seniors, 60 and up
Love it.
to know about veins and arteries when they see those symptoms?
Oh, definitely don't hesitate. Don't wait. Another thing we love to talk about is preventative care.
Yes.
And not every patient needs a procedure. Some of it could be just simply some medication that might help or something like that.
Right.
But our team is really dedicated and skilled on making sure that things don't progress. So, always talking about keep your legs moving.
Right.
That's something we always tell everyone, keep your legs moving.
Yes.
You don't want to come see us, keep moving.
There you go. That should be on a T-shirt somewhere. If you don't want to see us, keep your legs moving.
I love it.
So are you out in the community doing educational events?
Yes,
Okay.
absolutely. We've really hit it hard this year. I had seen a need because my job, I do visit clinics.
Yes.
That's what I do. I try to get doctors to send us referrals, which has been widely successful. But I saw a need where we need to talk to patients directly. We need to not depend necessarily on a doctor to educate the public.
Yes.
We need to start taking that into our own hands. And so that's what we've done this year. We've increased everything we've done, is super involved in the community. And just making those connections is really the best part of my job. So.
Absolutely, absolutely, because education is the key.
Absolutely.
For everything we talk about on this show,
Yeah.
it's education and getting that out to people
Yes.
so they can spot things themselves
Right.
and not rely on other people to say, you might have a problem.
Right.
Because
And-
if you feel something, you probably have something that you need to deal with.
Exactly. And you don't know what you don't know.
Right.
So I had no clue that peripheral artery disease was even a thing. Like, what is this crazy word?
Right.
So, being aware of what that is and how serious it is, because it affects 1 out of every 5 people over 50.
Oh my goodness.
1 out of every 5, and it is extremely serious. Yeah,
Wow, that's shocking.
It is
And not
shocking.
to know about that. That
It
is
is.
very shocking.
yeah.
So other than being at the Senior Expo
Yes.
on the 30th, yes, we're
I'm
all going to
so
be there.
excited.
What other educational stuff do you have going on?
Oh,
Do you have-
yeah. So we do anything. We have like an educational bingo. We'll go into senior centers and do, which is so fun. We do health foot checks for dialysis clinics and that type of thing, where it's a lot of one-on-one time with someone, just education. It's,
Right.
Do you have numbness in your toes? Are your legs restless at night? Are you, all walking them through all the symptoms? And if you get through a whole line of symptoms, you're like, you really should probably seek
Right.
help.
Right.
So
And where is your clinic located?
we're located right off 49. Pardon me. We are just south of the Cross Church
Okay.
in Rogers.
All right. I know where that is. I know
Yes.
where that is.
Everyone knows the Cross Church, so.
Yes. So we're talking about our seniors, vein and artery health. You probably don't need a referral to go there. I would suggest that go get things checked out.
Absolutely.
Go get things checked out.
Yeah, if you're already in care with a doctor who's kind of treating this,
Yes.
or maybe they don't know the terms, but they know something's going on, just go ahead and mention it to your doctor. Hey, I heard about this.
Right.
What can we do to help it?
Absolutely.
Yes.
Absolutely. All right. Thank you so much for joining me today.
Thank you.
I've learned some. I need to go and get things checked out. Keep moving my legs.
Yes, keep moving.
Keep moving my legs. And we will see you at the Senior Expo. And thank you for joining me today. Bye-bye.